Hi, I'm Sherry Harlan Davis, program host for Reid Beside You. And today, join us in our episode all about Reid Health Hospice is Kristen Kriz. She is LPN and outpatient hospice. Welcome, Kristen.
Hi, Sherry. Thank you for having me.
We always like to get started on learning how our guests came to Reid. So, how did you come to Reid?
Well, I've been at Reid for 16 years. I started in food nutrition, and then I moved to an aide on psych services. And then from there, I got my nursing license. So I've been a nurse for 13 years, and I moved to hospice services about 5 years ago, and since I've been there. So I'm enjoying being with Reid Hospice.
Great. And do you live in this area?
I live in Hagerstown. I went to most of my high school there and graduated, and I'm still living there. And I went to Ivy Tech Community College and then graduated there in 2008 with my nursing degree.
Well, great. And we're happy that you have stayed in Wayne County.
Yes.
As we get started, define hospice for our viewers who may not know or may have a misunderstanding of what service that entails.
So hospice provides symptom-based care to those who are terminally ill. Choosing to enroll into hospice doesn't mean that that person is going to pass in the next few days. Actually, hospice's goal is to have the person for a minimum of 6 months. Earlier enrollment into hospice is best, so that way they can really utilize the program to the fullest. Again, minimum is what we're looking at is 6 months, so that way we can be able to be there during every step of that process.
And when you say symptom management, can you give me an example of system management?
Right. So we would work on if someone is having pain, we help get that under control. If they're having difficulty with breathing, we help get that more in control. Nausea and vomiting, any of those kind of symptoms, anything that really basically comes up, we're there for you to help with any of those symptoms. One of the things, those two things, the pain and the trouble with the breathing are two that we really focus on a lot within hospice services, though.
So you're looking at quality of life, how they are at that particular time.
Correct. Yeah. Yes. We're looking at quality versus the quantity.
Okay. The probably one of the biggest things, and I believe we'll have a slide, is what is hospice versus palliative care?
Right. That can be very confusing when we're talking about hospice and palliative. Hospice, with that, comfort care is for someone with a life expectancy of 6 months or less. We work with the family and the patient on symptom control. We assist with additional services in the home. So that could be additional aid services, homemaking services. Life-sustaining treatment, though, would be stopped during hospice services. We are available to make home visits 24/7, and provider visits and hospital visits are no longer required because we are doing hands-on care in the home, and we are available to the patient and the family 24/7. Visits are with visits and medications, supplies, any equipment that are provided by hospice are covered at 100%, and especially if it's related for hospice diagnosis. And then with palliative, it's going to sound very similar when with the first few things that I'll say, they are still care provided, but for someone that has a serious illness, that is a life-limiting illness, that can be started at any stage of that terminal illness instead of that 6 months. They also work with the patient and the family on symptom control. They assist with any additional services in the home as well. Life-sustaining treatment, so curative treatment is still able to be continued within palliative care. You would be probably directed to go to the emergency department versus a nurse coming to your house if you were to call for any assistance. potentially at that point. And then you'll still be able to have provider visits for palliative and still go to the emergency room and still be admitted into the hospital as needed. And then visits, medications, supplies, and equipment, they still may require a copay within palliative care.
Okay. Now, one of the things we found is with the team approach for a hospice. Can you explain that?
Yes, so when we are talking about hospice services, you have a whole team that's caring for you. We have our medical director, who's Dr. Sanis. He works with your primary care provider if you choose to have them follow in hospice services, and as long as their provider is willing to continue with that. We have nursing care, so we are required to make a minimum of 1 time a week nursing visits. We can absolutely alter that, though, to the need of the patient, so we can absolutely come more than just 1 time a week. We have aid care services, so we have that up to 5 times a week, and they assist with bathing, dressing, and grooming needs. We have social worker support. They're available as often as needed to help with emotional understanding and psychological stressors within the whole process of hospice and the understanding the disease as well. The spiritual support is available as often as needed as well, and they help, again, with the spiritual, emotional support, and then they also help with any bereavement services too that is needed.
And that sounds like, because it can be a very stressful time, so having that complete team, it seems like at any, as far as the medical side, the psychological side, and then just basic resources, you have a complete team there to assist.
Mm-hmm. Yes.
And where are those services provided?
So we are Indiana-based, so we do a 50-mile radius within Indiana. Some of those services that we, area counties that we service are Wayne County, obviously, Fayette County, Henry County, Union County, Franklin County, and Randolph County. We, again, are in that 50-mile radius, though, so if I didn't happen to say one of those counties within there, we would definitely still consider that referral and go from there, because we want to make sure that everybody gets that quality care needed.
And back on, to add into the partnership of the care team, can you talk about the partnership we have with families?
Right. So as you're in hospice services, we understand that the illness will probably worsen. So hospice is there, again, as that team approach to help adjust or add medications as needed, to get supplies and equipment in the home, and overall just educate on the dying process. So again, looking at that team approach, having that support from all the services that we have within that too.
And I'm just to reiterate, because I know this question continually comes up, because for so many people, they hear the word hospice, and often, because people put it off for so long, they will say, oh, they're under hospice care, and often they will die maybe within a week. So once again, we can visit how hospice differs from the palliative care.
So palliative is actually a bridge to hospice care. So the main difference between that is that with life-sustaining treatment, so curative treatment that we're looking at, it's discontinued with hospice services. But with palliative treatment, that curative treatment can still be continued. And again, similarities, each of the programs are working towards helping the patient and the family understand their diagnosis better, and becoming better prepared for what may come next with their symptoms, as well as management with that. And again, hospice provides at least weekly nursing visits and aid care as well for that 6-month period. And after that 6-month period, though, we're not kicking anybody out of that program, out of our hospice program, if they still qualify to be in hospice services, Dr. DeSantis can make home visits at that point in time to make sure that they still meet criteria. If that patient's still able to make it to a doctor's office and make those visits, they can absolutely still come out of the house and go see them to see Dr. DeSantis at those 6-month follow-ups. So, but after that 6 months, follow-up. But just to make sure that someone still qualifies to be in the hospice program and still wants to be in the hospice program as well. They're continuously reevaluated while they're in the program, just to make sure that they continue to meet criteria.
Okay. And where are the hospice locations? And also letting you talk about their new location.
Yes, so we have a new location. It's at 1913 Chester Boulevard here in Richmond. And then the Palliative Care office is actually down the road. Again, just another way to show that we are actually two separate entities within the care. And it's at 1350 Chester Boulevard in Richmond at the Reid Health Geriatric and Transitional Care office.
Okay. And once again, what type of patients can benefit from hospice, as well as when will they know that hospice is the best path for them?
So anyone that has an incurable illness with that 6-month or less life expectancy, this can be an illness that's involving your heart, your lungs, kidney, liver, cancer. It's not just where a lot of people think that hospice, you have to have cancer to be in the program. It's any disease process that you have a life expectancy of 6 months or less. So we're also seeing that the treatments that the doctors are doing, they're just not working the way they should be for that patient to be getting better, continually going back for the same treatments, the treatments becoming closer and closer together potentially as well. But you can choose to enroll in hospice program early, which is, again, best to do earlier rather than later, again, because that way we can become kind of like an extension of your family. We become part of that, getting to know you, getting to know the family, and getting that relationship built up, so that way we can also be there to see any kind of needs that come about, whether emotional, spiritual, physical needs, anything that comes about. We're able to be there, and it not to be a rush to happen. We're there to ease into everything that happens.
And just an observation, it seems that getting a relationship with the hospice providers earlier can actually provide the needed resources that the family will need, and it's not just saying we give up, but it actually a proper pathway for the family.
Absolutely. So that way, we all understand that caregiving is it can be very stressful at times. And whether it's not stressful for several months, there could be something that just kind of makes you feel like at this moment, things are a lot more stressful. So we would be there to help support you with talking with you through whatever that issue is. We can help get any kind of equipment in the home, again, that would help with that caregiving needs. If we needed to get additional support in the home, again, if there was any additional aid services or homemaking skills, we would be there for that. And again, to be there during that process, instead of it having to happen very quickly, because the services may not have been in place as soon as they could have been.
And the other thing is, with your experience, then you getting that service in earlier, you would have the chance to see the different changes, whether it be weekly or monthly, daily, and to get that process started. So once again, being the extension of the family.
Mm-hmm. Correct. And just being able to be there for that symptom control when that comes up as well. So whatever those symptoms may be, just being able to be there and to have that security to know that you trust that person that's coming in and educating you on how to give that medication, when to give that medication, and what you're looking for when you're giving that why you need to give that medication, and trusting that person. That's another reason why we want to become that extension of your family within that, just because we want you to have the best possible experience that you can within hospice services.
Right.
So.
Then you've talked about the actual support team, but what's the level of care that falls under hospice?
So there are different levels of care that what we call it. Most of the time we're looking for routine home care. This is where the patient is going to be in their home setting. So this could be at their friend's house, a family member's house. It could be at their personal home, a nursing facility, assisted living, honestly, wherever they're going to call home. That's where we would provide that routine home care. So families, friends, private caregivers, they're the main caregiver support. We are there as a support system to them, and we're there with the education, and we are able to provide on how to provide care as the symptoms progress, as the person declines. We're helping also with medication management and the illness advances as well. So again, we're not in the home 24 hours a day, so we're just that support system. We're available to you 24 hours a day. I always tell people, in the middle of the night, if you have a question, we're here. Give us a call. We can talk you through it, or we can even come and see you in the middle of the night if needed. Talking about how he's talked about how caregiving needs can be a little stressful at times. We also have respite care. And it's available to those that are in our hospice program that have a family member or a friend in our services that where the caregiver needs some relief from caregiving needs, or maybe they got ill themselves and they can't take care of the patient in our services. So we are able to have them come into our respite program, which they could stay for 5 days every calendar day. And then they could return back with the hopes of returning back home with a caregiver. Those services are actually on 5 East is the floor that we're contracted with. So the patient would come to the hospital on 5 East, and they would stay with us for that 5 days and again, return back home if needed. We also have inpatient services. So again, this is located on 5 East as well. And it's available for a patient that has symptoms that are out of control, which require management in a hospital setting. An inpatient is a short-term services that we are looking at, and it'll be discontinued when the symptoms are under control. So as much as we strive to get the patient back home, there are times the patient is unable to fully get their symptoms completely under control to be able to go home. So it may be possible that their remainder of hospice time would be left in the inpatient setting, and once they get comfortable with the potential that they could pass while inpatient hospice, our goal is always to be able, again, to get someone back home or get them to home, however that goes, but with the understanding that we know that it's a potential that they could pass while they're inpatient. And then we have continuous care, which is going to sound kind of similar to the inpatient, but this is actually when your care is at home. It's a short-term period where services are provided in the home, and the patient would again have symptoms that are out of control that would require nursing services to be in the home longer. This must be approved by the nursing support and the attending provider as well to make sure that they do qualify for this services. But we would be there again in the home setting until we could get those symptoms more manageable, and maybe if the family felt more comfortable on giving medications. And again, hopefully we could get those symptoms under control and get them back to maybe a little bit more of a baseline where they were before, and then we could move about with our services as we were. There's also always a potential that we would need to look at other routes within, if they needed some additional services at that time, so different support in the home setting. There have been times as well that when we're doing continuous care that a patient may pass during that time once they get comfortable, just because just during the dying process. That's sometimes what happens. So.
And we get to a different part of that subject called insurance and how to pay. What?
Yeah.
So if what would happen if my insurance didn't cover hospice, or is that a possibility? Or explain that to me, please.
So a lot of times when we're talking hospice, we're saying Medicare. That's just because a lot of times we're looking at a population that probably has Medicare when we're talking about hospice services. Not always true though, but Medicare would pay it at 100%.
Okay.
So that's why we talk about how there's no cost to you when it comes to that. But honestly, you won't be turned away because of insurance, and we do whatever we can to make sure that your billing is not reflected on our services, just because we want to make sure that you get the proper need the proper care that you need within our services. So you'll probably hear when a lot of people talk about, like I said, Medicare, but it's any insurance. There's usually some kind of a clause within other insurances
Right.
for hospice services.
And what's a guesstimate of the cost? I know you were saying normally you wouldn't receive a bill. A lot of times just due to age and people qualify for Medicare, but we're starting to see younger people, maybe they had insurance, then they lost their job, and
And as long as it is related to your terminal illness, so what's causing for you to be in hospice services, your medications, the visits by the team member, equipment that you're needing, incontinence supplies. So if you're having trouble getting to the bathroom in time, wound supplies, anything like that, that would be covered 100% by hospice services. So again, if it's related to that illness, or if we feel like it is contributing to that, it definitely would be covered 100%.
Okay. And what spurred the decision to move this particular Reid service to an off-campus facility?
Well, we definitely want our service to have more of a noticeable presence in the community, allowing the community members to have a chance to stop in and ask questions. Feel free to do that whenever whenever we're open, and hospice services, and be able to talk about hospice services and set up referrals for themselves, or maybe a loved one too. Just having that more free ability to do that.
And what's another advantage when you were saying the community can visit without having to walk through the hospital? I think that's just some added stress.
The hospital's so big, and we have services that we provide, in the inpatient hospital on that 5 East, and then we had an office off in another area of the hospital. So trying to find where we were before was a little hard for, I think, some family members. And so, I think this will be much better for the community to be able to come straight to our office. You don't have to try to figure out where we are in that big hospital. So we're just one office now. So.
And what changes in care can family members expect for their loved ones in this move?
They shouldn't see any change in care. They should expect the same exceptional care that they have always received with our services. So.
And how will the new office work with other departments in the that are at the main hospital?
We'll continue to work with the offices on the main campus and the outlying offices as well, as we have in the past. So we'll still communicate with the providers that we are getting referrals from, and update them as needed.
Another thing is, what would you like people to know as the main thing? How about, I know a lot of times probably the number one thing is making sure that the family's working with the providers. And what would you say about being an advocate?
I definitely say I'm a firm believer to be your own advocate when it comes to your health. So whether it's you or your loved one that you're caring for, be the advocate. Don't wait for that provider to specifically say that you need necessarily our services. Just ask questions, seek advice, talk to friends, talk to family members. You'd probably be surprised by the number of people who have actually used hospice services and go from there and come in and talk to us too, ask questions. And we definitely would talk to you about if you or your loved one didn't meet hospice criteria at this moment, we would definitely maybe even suggest talking about doing some palliative services. So with that, it's wonderful how how we talked about how palliative is a bridge. Dr. DeSantis is actually one of the providers within palliative. So he would be a bridge over to us as well with your care. So he would know how your medical background is. He would be able to just be able to follow your care within our services if you came over to hospice services. So, but again, just be an advocate for yourself. And then you can search our website as well. It has questions and answers within that. And then you can always give us a call and come and see us at our physical location too.
Well, Kristen, we would like to thank you because you've given us a wealth of information and we want to make sure people have the information. Go to the website or stop by your office during office hours, please, if you're just coming to visit.
Yes.
Between 8 and 5. And once again, we would like to thank everyone as well as Kristen Wiz for joining us today on this episode of Reid Beside You.